Hello, everyone, and namaste. I'm so happy to see you all today on the special occasion of International Women's Day. This is Dr. Srinidhi Chidambaram welcoming you to the special Women's Day Facebook Live series from Apollo Hospitals. We also send you lots of warm wishes for the best of health, success, peace, and joy on this significant and special day. To many of us, health equates with fitness or the ideal body weight or absence of lifestyle diseases like diabetes or maybe great agility and endurance. But that is not the complete definition of health. When you define holistically, health involves not only a healthy physical body, but also a stable and calm mind. Even though now we know that it is as important as physical health, mental health, especially for women, is often brushed under the carpet and ignored sometimes by the women themselves or thought of as something that can be overcome by willpower or dealt with later. Many even associate the fact of sharing mental health problems or taking treatment for it or seeking help as something to be embarrassed about. So they avoid reaching out to a doctor who can address their concern and help them in overcoming them. There's also a lot of lack of awareness about the early warning symptoms. And let's not also forget that mental and emotional well being also influences physical health, and the mind body connection is actually a fact. So, we decided that in this session, we are going to talk extensively about common mental health issues, and we are going to get expert opinion on how women can aspire to optimal mental health. So today I am delighted to welcome Dr. Keerthi Pai, one of our senior clinical psychologists and she's going to give us her insights on how to keep good mental health. Dr. Keerthi Pai has an MPhil in clinical psychology from KMC Manipal and a PhD from the Madras University. She's a consultant clinical psychology expert in Apollo Hospitals. She's a mental health advisor in the Apollo Shine Foundation and a partner in the Element Psychological Support Services. She's a guest faculty in the Institute of Mental Health, Chennai, joint secretary of TNACP, and has also been trained in marine psychology from Denmark in 2011 and is involved in the psychological assessment and therapy for seafarers in Southeast Asia. She's also a certified clinical supervisor from ACA Australia and especially trained in managing grief therapy, conducts regular webinars for mental health professionals on grief therapy as well. She also consults with adolescents with giftedness where IQ and emotional and social skill assessments are done, trained in several psychological therapies like CBT, emotion regulation techniques, social skills training, etc. Welcome, Dr. Keerthi Pai. Thank you so much for joining this session.
Thank you, Dr. Srinidhi.
A very important session and not a subject that is often discussed, though nowadays people find it much more comfortable to talk about mental health issues, but definitely a topic that can't be ignored. So thank you so much for joining in. And viewers, I do hope that you're also going to ask a lot of questions. But let me begin the conversation by asking you to tell us what are some of the common psychological or mental health issues that women face, and would it be like age-wise?
Right. At the onset, I would like to thank the Apollo team to be calling me here, talking about women and mental health, especially both topics which are very near to my heart. Usually when we look at women, we are always considered as, Nari Shakti, and a lot of terminologies associated with us. But I always think that it's always in the media and the books which we listen to all of that. But when it comes to grassroots, women are always considered to be secondary to the other gender. So what happens is when we look at mental health, that again, there is a lot of stigma out there. So looking at your question, we understand that when it comes to mental health, women at all ages, right from the time a child is born, I think, right from the time a girl child is born, there's always this question of, it's a girl child. How are the parents going to manage her finances? Because it's not just the education part, it's also moving ahead into giving her into marriage, and then moving ahead in her life, and then her pregnancies, and then there's a lot of financial constraints which parents, even educated, higher socioeconomic status parents are looking at. So I feel right from the time a girl child is born, there is a part of intergenerational trauma which happens, and then as this girl child grows older, the girl child goes through into different aspects of, it could be anxiety, it could be depression, it could be trauma related other aspects, and of course we do have our, the menstrual cycle to add on to our emotional upheavals. So, we all know how the estrogens and the progesterones influence our mental health. All of that at each time of your life as a woman impinges on the mental health aspect as well. So along with that, with the biological aspects, we also see a lot of sociocultural aspects influencing the psychological well-being. And I'm really glad that, on the Women's Day, we are talking about this, helping, empowering women throughout the world, looking at themselves with love and kindness.
So what do you think are, I mean, I know it's like a very broad topic to discuss,
Yes.
but for our audiences, what are some of the most common psychological or mental health issues that women face?
Right. So when we look at the classification, so we have the International Classification of Diseases, the ICD-11, which we use now, and the DSM, the Diagnostic and Statistical Manual, one by the WHO and one by the APA, which is our guideline. It gives us very clear, structured guidelines on different aspects. It could be anxiety-related disorders, it could be mood disorders, it could be bipolar, it could be a personality disorder, which are common in both genders. Now, we also see that as a woman, we do have higher preponderance of getting all of these disorders. We also have other disorders specifically for women, which could be postnatal depression, or it could be premenstrual dysmenorrhea or premenstrual dysphoria. So, women also are highly, having a higher proportion of getting into these kind of psychological disorders. So as women, we have our hormones and the biology to also address about. So, like how we would look at anxieties and mood disorders like depression or bipolar, we also have to understand that like any gender, we also have these biological aspects to worry about, or talk about, and then awareness created is always the strength which we are creating.
Sure. So let's talk a little bit about, one which we always now say that, stress is one of the root factors for many of these issues, which kind of evolve into something more tangible and serious. So could you tell us what is the role of stress? And, I mean, I know it's not possible to avoid it, but what would be your guidance to women on how to keep their, what I'm saying is that, to make sure that they're at least like how we do a preventive check and maintain a good lifestyle, in the sense we exercise every day, we eat healthy to maintain a physical health. So
Right.
mental health also has influencers like stress and, all those early signs. So what I'm asking is like, okay, let us even begin by asking like, what are the earliest signs that, like there is a difference between just feeling a bit premenstrual or just a bit anxious to something that is a little needs, or does it all start with some early signs that people must try to how do you it's easier said than done, but then we need some tips on how to keep that live with it, cope with it, and keep it balanced.
Right. So there are two aspects here which I understand, Dr. Srinidhi. We are also asking about red flags to look at, and then moving on to what do we do about these triggers and the warning signs, right? So let me answer the first question of what are the red flags which we need to look at as women, as parents in our children. Of course, now as we all know, sleep is a major aspect here, especially during the pandemic and after the pandemic is almost, on a plateau now, because most of the time kids are at home. We do not have a sleep cycle, so our circadian rhythm is totally upside down now. So what we are seeing is, girls are sleeping. I'm not saying girls alone, we are looking at all genders, but because today we are focusing on women, I'm using this particular term as girls. We're seeing kids as such and adolescents, teenagers sleeping at, the times which are totally away from their normal sleep cycle, which definitely is a huge red flag. So many times what happens is, because the sleep cycle is not done properly, the eating cycle also gets haywire. So, there is a lot of binge eating, there's a lot of eating way through. In the daytime, they do not eat well, or they binge on junk food, or they eat something which is not healthy, or they have a long time of, starving, and then they suddenly go and eat. So all of that is going to affect the physiological aspects of it. And we do see a lot of eating disorders in people, young kids, and then moving ahead with adolescents and young adults. So the red flags to me would be definitely sleep and appetite changes. We also need to look at behavioral aspects. So is the child or the adolescent keeping too much into the room? So is she being aloof? Is she not talking too much, or is she getting more angry than before? We always think that, during the PMS, all the girls will have some moods, but we are also looking at, are these the general mood swings, or are these too pronounced that the mood swings are too much? Are they also talking about self-harm, or are they actually indulging in self-harm? And these are definitely red flags which the parents, the educators, and the others need to look at and try and help the child, support the child, help and the adolescent, and help the child to bring in, develop awareness in parents, and take the child for a mental health consultation. Yeah. So as we move ahead, we look at other red flags as to, is the child spending a lot of time on social media? Is it only a private chat, or is it more on gaming? So we see a lot of gaming behaviors happening throughout generations, throughout genders, and we see a rise in that now, especially after the pandemic. So that's also something as parents, I think we need to look at in kids and adolescents, whether the social media influence is helpful in certain way, but in a large extent, is it not helpful to the child and the adolescent, especially the girl child, because as you said, body image is a strong influencer when it comes to social media, and that can lead to a lot of bullying and social isolation. Even though the classes are happening virtually, there is still a lot of bullying and isolations happening even in the virtual classroom. So this is also something as parents we should look up and try and help the child with.
So what would be the red flags as a woman approaches maybe the childbearing age, and then,
Yes,
into
yes.
perimenopause and menopause?
Yes. So moving on to, a child, and then teenager, and then a young adult who is now into college, and then moving on to work, and then getting into marriage. So these are all lifespan decisions which we make in our lives, and there is a kind of set rule in India that, you finish school, you go to college, it should be either engineering or law or medicine. There's no other choice given. And then there is definitely a lot of stress there. And then as the child grows older, and then, once she gets into a job, she has to be in one of the, well-known companies. Otherwise, whatever she's educated is not going to be of much help, because in quotes, that is the marriageable criteria for the child, for the adolescent, or not adolescent, for the young adult. And many times her value is considered as, what is the degree she's done and where is she working. And till marriageable age, that is what they are looking at. After marriage, we do see a lot of families asking the person to leave the job, because then she has to start a family, she has to get pregnant, and then take care of the children. So many times that itself can cause a lot of stress as to why are we looking at girls simply as machines, give birth, study, get a job, give birth, take care of the family, go for work, manage work in family, come back, take care of the adults in the family, be a nurse in the family. And are we only stereotyping women? Are we only stereotyping the gender? And that's a big question which is in my mind, which is causing a lot of stress in many people when we talk to not only individuals, even when we have the support groups. This is a question which many people have asked me, and that's definitely a question we all as women should ask ourselves and raise our voices again. So because that's a strong, yes, Dr. Srinidhi.
Yeah, so what I was saying is, I think the families should reflect on all these things and
yes,
understand
absolutely.
that once a girl is given same kind of, like an almost they don't really differentiate now with the boys when it comes to pursuing the highest standards of education. But after that, I think the roles and expectations start.
We go back to the Stone Age.
Of course, we
yes.
can't help it that, it is that the woman has to bear the child, but
yes,
still it is kind of, suddenly there are expectations.
yes,
to kind of, suddenly from, from a professional status, still there is so much of work to be done at home.
yes.
Not many can escape. So it's
correct. It's almost like a crime if somebody is not married or somebody is not having a child within the 30s, early 30s, and then they don't have a second child by the early 40s, and they're considered a crime, which I think we should all raise our voices against.
It's important for the families not to succumb to that kind of pressure. Sometimes I think questions that others ask is what puts most pressure on families.
Yes.
Yeah, and those questions never end. I think even after that second child, the next will be, when is that child going to school?
Absolutely. Right.
So that's a very valuable insight there, that, it really starts with some kind of reflection and attitude change on the part of these and everything. So we were talking also about tips to kind of how to foster a good, in with all these pressures and society changes and all the stressors in mind. How does one really avoid it, and not avoid, but how do you manage it really?
So usually what we look at is there are different ways of managing stressors and triggers. So the most important aspect is being aware of what could be triggering. So we talk about the 3 A's. One is developing awareness. So A is awareness. So understanding what could be triggers, what can make me feel angry, what can make me feel bad about myself, what could be a trigger at home or at work, or it could be from the children or from the in-laws. So when as a woman, we understand that this could be potential triggers. It could also be, so long I was talking about extrinsic triggers. We're also looking at intrinsic triggers. So if there are times when we've had, a bad sleep, or we are having DPMSing time, or we are going through a hectic day. So we ourselves as such, the body is tired. So that could also be an intrinsic trigger. So we also have to be aware of external triggers, extrinsic, and internal intrinsic triggers. So when you are aware of these triggers, then it's also easier to move on to the second A, which is acknowledging and accepting these triggers. So acknowledging and accepting that, okay, now I am getting worried about something, my body is tired, I need to give myself that rest. So accepting, acknowledging that, I need that time for myself is very, very important when it comes to mental health. And then moving on to the action phase, which is the third A. So awareness, acknowledgement, acceptance, and action would be very, very helpful when it comes to safeguarding and promoting mental health in women. So when you know that, I need to take action as to, okay, I need to eat healthy, I need to exercise better, and I need my, me time to spend time with myself doing my hobbies, or just having a cup of chai, things like that, which help me to relax, is what we need to look at in the action phase. So the 3 A's. Yeah.
Yes, absolutely. That's useful. Yes. And also the action would involve, so when would be the time when, you have to take like, external help also, because
Right.
I
Right.
don't think in our country still, like going and seeking help from, even disclosing it to your family members is tough. But when you want to seek help, so I mean, unlike I think in the West here, it is still something where you have to, like really, does it warrant going and taking help from
Right.
a counselor,
Right.
psychologist,
Right.
therapist? So at what time or what point do you think this should happen?
Right. Right. That's a very important question. Thank you for
Yeah.
that. Because many times what happens is stress as such, anxieties or depression or mood disorder or anything related to mental health is always considered as a big taboo. People don't talk about it. Even things like talking about menstrual cycle becomes a big taboo. So you can imagine the kind of stigma it can relate to when we talk about being stressed about work, stressed about other aspects in life, right? So the first part is definitely having an awareness that there is definitely no stigma. This is our right. This is the woman's right to talk about and take help from a mental health professional. There is absolutely nothing bad about it. So the tagline a few years back WHO had brought in was, it is okay to be depressed, but it is not okay to be okay about it. I hope I'm making myself clear. So it is okay to be depressed, but it is not okay to be just be okay about it. So we need to, advocate mental health and work towards it. What we also need to understand is that, of course, the resources, which could be inner resources. So there's also another acronym we use, which is ABC. A is for accumulating positive memories. So do things which make you feel happy, maybe with your friends, with your family members, with your siblings, with your parents, with your spouses, with your kids. So and also with yourself. So accumulate positive memories, so that there is always a balance of good memories helping you, right? B is believe in yourself. So when you have that self-esteem, when you believe in yourself, you know that whatever happens, you have the inner resource to support you, right? And then the C comes as develop better healthy coping skills. So coping skills could be anything which helps you. So usually when we talk about coping skills, we look at physical activities, we look at social activities, we look at behavioral activities, which could be any behavior which helps you, reading a book, taking a walk, which we also look at using the five senses. So it could be, smelling a flower, or even keeping a candle, or having a warm water bath, anything which uses your five senses. So how do we help in coping? One is physical activities, move around, walk around, dance, do anything which moves your body. Number two, which would be helping you socially. So meet up with a friend socially, either virtually or physically, do things together as a family. Then behaviorally, whatever, which is a behavior which helps you to it could be reading a book, it could be watching something, and of course using your five senses. And the last one is cognitive activities, which is the self talk which we have to ourselves. So there's always this inner voice, inner critic, which tells us that you've not done that well, even if the mother-in-law, sorry for the pun intended, but tells us that you did not do this well. There is this inside inner critic who always keeps telling us that you could have done that better, you did not do it as well as your friend. And that inner critic is sometimes very very emotionally torturing and taxing. So we also have to be aware of that inner critic and not look at perfectionism as an answer. So you are good as what you are, and never compare yourself with others. So that also comes in the coping skills. So these are the 5 aspects which we talk about when we look at healthy coping skills. So
it's very important, maybe worth
yeah.
repeating once again.
Yes, yes. The physical, behavioral, social, using the 5 senses, and cognitive. So those are the 5 coping skills which we talk about.
Sure. So I think now we will go into some of the, like what I think now many of these syndromes and situations are well known to people. So
Yes.
this also like, so when you talk about anxiety, so, like so the coping skills are there, like you've just mentioned it, but then anxiety is also because of all those stressors. So what is I mean, what is really like, because we also use the word anxious simply in our everyday terminology. So what is the difference between an anxiety disorder and an anxiety or just feeling anxious? So when does it
Right,
become
right.
disorder?
Right. So according to the ICD, there are specific guidelines which talk about physiological changes in the body. You have your the palpitations, the tiredness, the sweatings, the physiological changes in the body, along with the generalized anxiety. So if you're worried about an exam, if you're worried about a job interview, or if you're worried about the promotion, or if you're worried about health of a family member, it's a very specific reason you have to be anxious. And the anxiety goes away mostly once these problems are sorted. So once the exams, 10th boards are over, they are fine, you're happy. So it's not an anxiety disorder, it's more of an anxiety for a specific time. But if the anxiety goes on for a long time, that's when it becomes a generalized anxiety, and then it becomes a generalized anxiety disorder. When the anxiety is free floating, when there is a lot of physical aspects to the anxiety as part of the anxiety, which is when we call it a disorder. And then when it happens as a panic, you also get difficulty in breathing, you get a panic attack, which would be difficulty in breathing, choking, and then you have palpitations, and then you have this cognitive thought that you are going to die, or you're going to have a heart attack, or you're going insane, things like that. And so those panic attacks add on to the anxiety. So we have very clear specific guidelines. So if you look at OCD as such, so which is again an anxiety disorder, so we all know we wash our hands, and it is stipulated mandatory to wash hands, clean ourselves just before entering any place. But then OCD becomes beyond that. So if the person is going on washing hands, not allowing others to enter the house without having a bath, completely changing clothes, then it becomes a clinically important syndrome or a disorder, which needs more mental health interventions. Yeah. So it's very clear in the ICD and the DSM guidelines that where exactly the line has to be. And that's when people can reach out to the mental health professional to help people understand whether this is just an anxiety or in quote stress, or do we need to clinically look at it as a disorder and take more specialized help for it.
Yes. We are having quite a few questions, but
Yeah.
before we move on to that and close the session, I wanted to ask you about two things. One is
Right.
in women, particularly, we already spoke about the adolescent phase, but we also have the premenstrual syndrome, then we have the postnatal depression, and then more importantly, also during menopause, we find that there are a lot of psychological changes. So maybe
Right.
a brief overview on
Yes. Yes.
really the
Yes.
postnatal depression and the menopausal disorders,
Correct.
which
Right.
many people, it's like almost universal. I think the
Right. Right. Right.
perimenopause is
Correct, correct.
not for
I
most.
think the menstrual cycle is something we do have a lot of rituals throughout cultures, and that's something which we all could relate to, going from any culture throughout the world, right? So we also know about the physiological changes connected to each of these stages in our life, right from menarche to menopause. We also know the role of the estrogen and the progesterones and the oxytocins involved in each stage in our life. So what happens, what we need to understand in general terms is that all of these hormones are definitely having an effect on our mental health as well. So what we need to understand is that this is a routine physiological changes which is happening in everybody's life, right? So it is also important that we look at it with the sensitivity it warrants. So women are very powerful because of all of these changes in their life. I can't imagine a man going through a delivery process and coming out of it with all the bleeding and the baby and all of that. However, we go through it, and it's not just once, several times, right? And that's something we need to give credit to the woman. And as the woman grows older, menopause again is a huge change. We see a lot of women going through when menopause, having depression. And we've also spoken to women who have had hysterectomy, who feel that a major part of their body is removed and they don't feel whole now. So it is like, I have lost a limb. So like, it's the same kind of feeling a person feels if he's lost a hand or a leg or a toe for that matter. It's the same kind of feeling a woman has, because the womb, the uterus carries a lot of connection to what a woman is in identity. So I have also spoken to many women after their hysterectomies feeling incomplete, in quotes, that I've lost something which is very near and dear to me, and which also adds on to their mood. It could lead to a depression. And there definitely something like cognitive behavior therapy has helped, where we are also able to understand and help the woman go through the different cognitive challenges of the womb itself does not always identify you as a woman, that you are much more than the womb. So we also need to look at that as as this person grows older into menopause. That's something which we need to look at. Empty nest syndrome is also something which we hear very commonly, because now we see as the child grows older, after college, after employment, after marriage, the child then moves away into another country, another city, another home, and then there is something called the empty nest. So the mother and the father alone at home, and the nest is still there but it is empty, and that can lead to a lot of loneliness, especially with kids moving abroad and the parents living alone here. So there's a lot of empty nest aspects happening, especially during the pandemic, because kids are not able to move back into the country and be with their parents, even though virtually they do meet, but it's not as easy as it used to be
Yes.
before the pandemic hit in. So that's also something which we need to look at. So the social support systems definitely help when it comes to having a community gathering, having neighborhood where people can talk about other aspects, having a group meeting. All of that do help in the support system.
Yes, absolutely. So now I think we will start looking at the questions that are coming on our
Yes.
feed. So, yes. So the first one is, why is it important that women's mental health issues have to be addressed separately?
Right. That's a $1 billion question. Thank you for asking that question. Personally, I think women as a species, we are very strong. So if you look at evolution, they were always trying to look at women, the gender as such. And they, compared to the other gender, we had a lot more to do to survive, because the men had to only hunt and bring back, but we also had to take care of the children, take care of the house, take care of the elderly. So right from, if you believe in evolution, right from the time we started living in caves, the women had a strong role and need to be very emotionally resilient. So the tagline is, there was a choice. We could develop muscles so that we become physically stronger, or we could develop brain stamina, brain strength, so that we could be emotionally stronger. And all women know what we developed. So that's why I think we need a Women's Day to celebrate women.
And also, so what was the next thing? Sorry. Yes. So the next thing is, Is addiction different in women?
Right. Yes,
This
yes.
sounds very familiar to me because I am addicted to ice cream eating in the night. I'm unable
Right,
to sleep without it. But I think the broader question there is addiction to more
right,
harmful substances. They say that women's bodies react uh, or get affected more by, like habits like alcohol and drug abuse. So a
right,
little bit about that, I think.
right. There is a lot of theories and research which talks about right from nicotine to alcohol to marijuana, even screen addiction, even internet addiction, even porn addiction. So there's a lot of research which talks about, but we surely do not know where is the clear demarcation, whether men are better or women are better. There is still a long debate happening there. And I think we need to have more research on that. But for that question, my answer would be personally that addictions are on the rise, especially now, because we do see a lot of people, and there's a lot of material also talking about women getting into substance use, substance dependence, even screen dependence, gadget dependence, and all of that. It could be because there are more women willing to get into studies. It could also be that more researchers are looking at women as a population to study. It could also be that there are more interventions and more funds to provide interventions to the women population as such. So why are we seeing a rise in substance use and gadget use and dependence in women? It could be all of this put together. However, what we need to understand is that if there is an addiction, we need to have an intervention for it. Yeah. So one is definitely being aware. In case if you need medication for it, yes, of course, we need to look at that. So medicines like SSRIs, which would help to reduce the craving, and if there is a additional mood disorder to it, of course, meet the psychiatrist, talk about medication, and of course other psychological therapies. If you feel that adjunct to the medication you need psychological therapies, there are a lot of therapies like the cognitive behavior therapy, the dialectical behavior therapy, interpersonal behavior therapy, all of which have been very evidence based, lot of research, reliable data to help people come out of these addictions and dependence.
Absolutely. My aunt is having bad dreams these days, and because of that, she's hallucinating. Is this some sort of a stress issue? How to help her come out of this?
Right, right. I am not very sure about the question because I only understand that this particular lady, I don't know her age. So I don't know if there is any comorbid, maybe diabetes or anything else for this particular individual. What I only understand from the question is she has dreams, and I'm not very sure whether her sleep is disturbed or not. And I don't know on what modality her hallucinations are, and if it is only in the nighttime or is it also pervasive in the daytime. So there are a lot of questions unanswered. So my suggestion would be, if possible, if you could bring the person, have a detailed evaluation, both physical health checkup and mental status evaluation. That would provide us with a lot of more information about what exactly is going through. It could also be life events which the person is going through. So I would definitely be interested to know with whom is she living, was there a life event other than the pandemic which has happened, which could also give us lot of insights into what this person is going through, which would definitely enable me to help, enable me to answer this question better.
I think the message would be that it needs to be addressed and needs to be looked at, I think, especially
Right, right.
vaccinations. The next question is, my friend doesn't want to talk to anyone now after her divorce. She's behaving rudely with everyone. Does she need medical help?
Thank you so much for being such a wonderful friend. You've been, so kind to your friend, and that itself, I think, is a huge, huge support system for your friend. Definitely, I feel as a mental health professional, all of us need mental health support. So it's not just because you're going through a separation or a divorce or a life event. All of us need to support each other. And if you feel that she is not sleeping enough, being very irritable, agitated, not eating enough, or even having difficulties with other family members or at workplace, that is definitely a red flag. And if you could talk to her, and if she's not willing to come to the hospital, we do have telehealth services, so she can talk to one of the mental health professionals and then take it from there. And I'm sure as a friend you would be willing and encouraging her to do that.
So the last question is, can someone harm themselves due to mental stress? Can suicide in a person be reversed? I'm not sure what that means, but perhaps prevented. When should we consult the doctor?
Right. See, we see a lot of, there are two aspects here. So one is suicides which are self-harm with the intention of dying. So the intentionality is very, very important here. There are also non-suicidal self-harm. So there is this demarcation in it. So we need to look at suicides with the intention of death. So if a person is having a very strong desire to die, and he or she has severe depression, and there is absolutely no support system, and the person has made a will, has made clear plans of this is what I'm going to do to take my life, and the person does this at an hour where there is absolutely no help which is available, maybe late in the night at maybe 2 a.m. when everybody is sleeping, and when nobody can actually find out that this person has done this, maybe after writing a letter, and all of that indicates to us that the intentionality is quite strong. Okay, having said that, we definitely need to help that person. And if by chance, if you see that this particular individual is depressed, is sad, talking about death, is irritable, agitated, not interacting so much, then it is definitely a strong red flag. Please take notice and bring the person or take the person to the nearest mental health professional. The other side of it is non-suicidal self-harms, is where people look at self-harm as a coping mechanism. So we see that in different age groups. So it need not be only in quotes the attention seekers. Definitely they are not attention seekers. And this is a very, very strong message I would like everyone to understand, that people who hurt themselves are definitely not attention seekers. They are indicating that they are in psychological pain and they need help for it. So what happens is, when you talk to them, they say the psychological pain because of all of these stressors, it could be academic, it could be relationship, it could be family, it could be occupational, it could be a mixture of everything. The psychological pain is so strong that they do not find a way out, and they think a physical pain would ease it out. And that's the reason why they would want to hurt themselves. So if at all somebody talks about psychological pain, it is very, very important that as their friends, as their family members, allow them to talk, give them that listening. And that listening many, many times allows them to ground, helps them to reach out to you, and then they are willing to come back and take mental health, a professional's help.
So I think, yes, I think that's about it. So thank you, Dr. Keerthi Pai, for this really very enlightening and wonderful discussion. So dear viewers, do reach out to us for any further queries or any particular concerns. We are there in all the social media channels, and you can walk into any of our hospitals in the group all over to take any help or to for any kind of psychological or mental well-being support and assistance. Modern living can mean very busy living. It can be full of so many professional and personal ambitions, raising a family, running a home, so many things. So which is why for a lot of women, mental health takes a backseat. But we can all take much advice from whatever Dr. Keerthi Pai has also told us. So there is an important way to cope with stress, manage it, keep informed, be future focused, sleep better, exercise better, stay body and mind positive, and above all, open up as well as listen. So as Dr. Keerthi Pai also said, womanhood is not just being a woman and being part of your family, but it also involves sisterhood, encouragement, compassion, support, and community. And health is one area where women can really lift each other up. So we have our theme for this year for International Women's Day is break the bias. So I think let us all break the bias when it comes to mental health and help each other out and truly develop optimal mental health. So thank you so much. Thank you, Dr. Keerthi Pai.
Thank you very much, and happy Women's Day to all viewers. Thank you.
Thank you.